Okay, so now we're going to do a demonstration of rectal administration. First, you want to make sure that you wash your hands as instructed earlier. You want to take the MAR. Make sure that you identify the individual by the picture. You want to check the order here on the MAR and make sure it matches the physician's order completely. Every medication should have a side effect sheet, so you want to locate the side effect sheet, make sure you've had a chance to look at it so that you'll be aware of any adverse reactions that could occur. You're going to go to the supply box, use your secure key, which means on your person and secure at all times, to open the box. Okay, so I'm going to locate the medication. And complete the first check. I'm checking the label against the MAR. And now I'm going to go ahead and lock up my box. I need to go to the bedroom to administer this to provide privacy. So lock your box and gather your supplies. You're going to need to take some gloves and a chuck, disposable pad, or some type of towel or something to keep the bed dry. Okay, so I'm going to approach the individual and I'm going to let her know that we need to go ahead and administer the enema. We'll need to do that in the bedroom to provide privacy. So if you will just come with me and we'll go on in the bedroom and administer your enema. Okay, so now we're back in the bedroom. We need to do our final 2 checks. So I'm going to locate the order in the MAR. Remember, you're checking the label to the MAR. I'm going to go ahead and take the enema out and check again. This is my 3rd check. I'm going to go ahead and apply my gloves. I'm going to approach the individual and let her know what we're going to do. Remember, when you come, you need to gather all your supplies. You need to have your medication, your MAR, a chuck or some type of disposable pad or towel that you can place underneath the individual. You want to make sure that they're positioned on their side, on their left side, with the right knee bent upward towards the chest. Okay, so approach the individual, let them know what you're going to do and where the medication is going to need to be placed. So I'm going to go ahead and administer your enema, and I need to put that in the rectum. Okay, so now I'm going to come back to the medication. I'm going to remove the cap. I'm going to approach the individual. All right, you're going to need to take a big deep breath for me. When we're ready here, I'm going to put this right in the rectum. Okay, so place your hand right here on the buttocks and you're just going to kind of separate it. You're going to take the applicator. You're going to insert it through the anus into the rectum. All right, take a big deep breath. And you're just going to kind of squeeze until the bottle is completely empty. When it's empty, you're going to remove it and ask them to try to hold it as long as they can. Take your hands and squeeze the buttocks together. Okay, can you hold that for me as long as you can? You want to try to get them to hold it about 5 to 10 minutes. You want to put the cap back on the enema in the box. Remove the gloves. You want to remove the gloves inside out. Put everything in the box and you can just throw that in the garbage. Make sure you wash your hands and you document that you've given the medication. But stay close by because you'll need to be able to assist them to the restroom.